Hey, what's up? This is Dion Lewis, founder of Healthy Project Media and the host of the Healthy Project podcast. Join me as I speak with change makers who are doing the work and sharing their stories, insights, and innovations to close gaps in healthcare for everyone. Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Dion Lewis. I have another great episode today. Have two guests talking about some great work that they're doing. Pamela and Lauren are here with me today to talk about something that, again, I know I say this a lot, but something I haven't really spoke a lot about on the podcast, really at all. So, or I know not at all. This is the first time I've had this conversation, and I think it's super interesting what you guys are doing, and I can't wait to get into it. So before we get into the conversation, we'll start with you. Pamela, can you tell us a little bit about yourself, and we'll get going into it.
Great. Hi, my name is Pamela Rowe. I'm a speech language pathologist, private practice owner for a quarter of a century, over 25 years in the state of Florida. We work with all ages, children, adults, and I'm also a public health consultant. And that's where I met Dr. Lauren Ramsey, on this project. So we're really excited to tell you more about it today.
I am Lauren Ramsey, and I've been in public health about 20 years doing public health research, mostly maternal and child health, health equity, racial ethnic health disparities, community health. And I met Pam here through a public health club that we are both a part of, and we've pursued, I believe we're on two projects together. This is our first project together, and I pulled her into another project I'm working on. I am the owner of my own public health consulting business. So that's how we connected. And, we just find stuff we're interested in, and we work together to get the information out there. So nice to be here.
Hey, public health entrepreneurship. That could be a whole nother episode because things are real in that space right now, but we won't go there. We won't go there. I want to talk more about the teleaudiology. Am I saying that correctly? Hopefully I'm saying that correctly. Let's talk about, the problem. What challenges do families face when trying to access timely and comprehensive audiological care for infants who are deaf or hard of hearing, especially in our under-resourced communities?
Yeah, so we can think of under-resourced. It's a loaded term, isn't it? Sometimes we think underserved as in they can't access it spatially, regionally. It's outside of their reach. But there are other barriers to some of our families. Sometimes there's language barriers. Sometimes there's cultural barriers. Sometimes there's just that health literacy, being able to access and understand the information. So it's a major need. A lot of the times our families, our parents are first told about this in right when the child is born, where they might do a special test to see if the child is hearing, the baby is hearing. And then at that point, they have to do a follow-up if they do not pass that initial screening. And then there is also further follow-up to continue the care. The barrier really comes into play when people have difficulty with transportation or just reaching those appointments, or even having an understanding of how important they are. There's also access of just not being able to pay for it, and really not having the insurance coverage to pay for it. So there's all types of barriers that our families are faced with, and it is so critical for the babies to get that early identification and to be able to move forward and receive the care that they need, that hearing health care that they need.
Yeah, perfect. What you kind of brought it up earlier, Pamela, about, the not even understanding or knowing that health literacy piece, which I think is so vital, so important. How does the lack of access and that maybe that health literacy piece, how does that impact the early intervention outcomes and some of that long term development? Can we talk a little bit about that?
Dr. Ramsey, you want to take that?
Sure. So I know when someone is hearing something about their child at a young age, like needing those support services, it can be, for lack of a better word, devastating, many questions. So, and that parent education was a big factor barrier for that follow-up care. So we do know that sometimes maybe providers speak to patients in a way that they may not understand. So they are getting all these terms and just thinking like, well, what does all of this mean? And
Right.
it could be, the loss to follow up because maybe they didn't understand like what all of it meant. What were they supposed to take the next step? Was the doctor reaching out to them? Like, what is really happening here? And on the flip side, providers not knowing what resources to provide or give to their patients. So they do have programs where it is kind of like a wraparound service. So you're not just getting the hearing screening, but the parents and families need training on how to live life and proceed with their child who might be, who's deaf or hard of hearing. It's going to be some differences and adjustments. And I think that that's not always clear in that first part. One, just trying to understand, like, how did this happen? But I don't think the support is necessarily there on top of like having a health, like a literacy issue. Um,
Hmm.
so I think when the services are delayed, it does not help, but like cause a barrier for like the social emotional like development, learning, language, because if you're not necessarily hearing things adequately, how to communicate, all of those things can be detrimental to children as they enter school and interact with other children and adults. So they're not developing those like early language skills that they would need.
Yeah, and I will say just a quick story. I had a similar situation with my son. My
Mhm.
son, um, he spoke just kind of gibberish, and I didn't know any better. I'm just thinking, oh, it's just cute, talk. But then it wasn't until my wife was like, that don't sound right. And it,
Mm,
it was the fact someone was like, oh, it sounds to him, when you talk to him, it sounds like you're talking underwater.
Mm.
But if we didn't understand, and he had to get tubes and go through speech therapy and do all these things. But well, I'm saying we, like I'm the one knew, I ain't know no better. If I didn't know somebody that understood this isn't right, you just kind of go about your life and not knowing what the services are. And to your point, Dr. Ramsey, like if one, you're hearing something about your child, hey, your child is hard of hearing or deaf, that's all that's going through your mind. And I can only imagine the information you're getting is going in one ear and out the other, because you get into maybe survival mode or trying to figure out how I can do this, and you're not really understanding, or the provider may not understand all the services that are available to that person in their community, right? So there's a lot of communication, there's a lot of gaps that aren't being closed because of some of that. But you all have a solution, and you guys are doing some really good work. Tell us about what is teleaudiology, and how does it help close some of these access gaps?
Yes. Well, we conducted a literature review. I want to say thank you to CSTE, which is Council for the State Territorial Epidemiologists. Um, they sponsored this literature review. And just to illuminate the feasibility and what is teleaudiology. Teleaudiology is done all around the globe. This is not just a United States thing. This is prevalent in India, in Australia, doing amazing things in Brazil, as well as the Philippines. And what it entails is you will have an audiologist that is able to provide the services remotely. And there will be a facilitator, a person in person, either at the home or at a community location where the parent brings their child in, and the testing equipment will be there. The audiologist will be overseeing the testing with the help of the facilitator. It could be an audiological assistant that will be conducting the testing. So it's bridging the gap. So why is it so significant? Well, not everyone can go 2 counties over, or one state over, to an audiologist. This feasibility is immense, and it allows for individuals to actually get those services in their community. It reaches more families. There's the early identification of more babies that are born deaf and hard of hearing, as well as the services and the follow-up and the support that they need. So there's so much to it. It also provides a hub for the providers in the community to be able to send their patients there and know that they're going to get quality care in a timely manner. There's a huge difference, such a huge difference between waiting 6 months. A lot of language development happens in 6 months, anywhere in that continuum, whether it's birth to 6 months, huge amount of communication development that depends on the hearing and the interaction with the parents, right? So it's very, very critical to get that timely services for the children, and teleaudiology helps.
Awesome. Did you want to add to that?
I did, because another concern and where teleaudiology could bridge the gap, there's a limited number of specialists as well. So they may not have a specialist in their community that's nearby. So like Pam mentioned, transportation, they might be driving a couple hours just to be able to get to a audiology appointment. So this could bridge that gap, because they could speak with someone who's maybe not that close to them, and they are overcoming that barrier of transportation.
Yeah, that is so real. And even I don't know if this is a concern in your guys' communities, but even there are a lot of rural areas that same thing, right? Like the closest clinic or the closest hospital or specialist even is miles and miles away. And when globally or even in the United States, transportation is a big issue, you got to make it, you got to make a choice. And man, I got gas money and I got to do all this. And I don't know what the follow-up services look like, but now I got to go back in a week, or I got to go back in a month and follow up, or what that looks. I think there's more to this than what people realize when it comes to somebody. And we're talking specifically about a community that doesn't have all of the resources just right there available to them. The amount of energy and time this takes, and why something like what you guys are doing is so important, and more people should understand and know about it.
I also want to throw another important factor in there. Can you imagine you're in an underserved community and medical mistrust is very, very real? It's very real.
Man, talk about it.
It's very difficult to hand your elderly parent over for testing. Can you imagine how hard it is for some communities that have experienced and are experiencing things that exacerbate that medical mistrust, to then just engage and say, oh yeah, I'm going to have my baby continually tested? And when we have those trusted resources in the community where rapport and relationship can be built, it makes it more likely that our parents are going to feel more comfortable to engage in those services in their community, rather than going to a strange community in a university hospital somewhere. that doesn't know them, and they don't necessarily have that relationship. So for a lot of our families, relationship is everything. A lot of our cultures embrace relationship over everything. And teleaudiology is another piece to that puzzle to allow for that community relationship where they can know, hey, you need to get your baby's ears tested. They do that right there at that center, right there in the community.
Yeah, that's good. That's good. What are some of the, thinking more about the testing and, what are some of the current policy and insurance coverage limitations around teleaudiology?
Well, not all insurance plans cover it, number one. Number two, there's limitations. They might cover and reimburse that first visit where the audiology has to just squeeze everything into the first visit, but it doesn't always cover the follow-up visit, which is also very critical. It does not allow for orientation. This is very, very difficult for parents to even wrap their head around. And teleaudiology could be a great way to have that pre meeting with the parents to tell them what to expect, to let them know what's going on, to be able to field some questions, to talk about it. It could be a huge counseling avenue, not only in English, but in all other languages.
Mm-hmm.
So we're thinking about how to reach our families through a lens that they're able to engage in, not only linguistically, but also culturally. Having someone that looks like you
Right.
explain what's going on, or also having access to other parents that are going through the same thing, that they're going through the same lived experience. That's huge. And we have technology. We got to use it the right way.
No, 100%. Mm-hmm. What changes are needed to make this model sustainable and even, equitable?
Do you want to take that, Dr. Ramsey?
So I think it really starts with policy, like Pam was mentioning, reimbursement. Also, the type of services available, improving the quality of those services. I know some people have concerns about like telehealth in general, and there are many reasons why it may not be a quality experience for them. So I know, so for example, having a person or a baby child who might be deaf or hard of hearing on top of them, maybe Spanish is like their language that they speak in their home or another language, the having to have like a translator on the line on top of having on teleaudiology, like an appointment, that could also present some concerns or issues on top of having a health literacy issue
Mm-hmm.
within the family. So there are some things that still needs to be, worked out. But I would say the main thing is like the having insurance reimbursed in a timely manner and also cover those follow-up visits and orientation visits, because a lot of it will include not just testing the baby for hearing or checking in on like equipment or anything, but really engaging with parents in a way that, more one-on-one, intimate, spending time. And I've worked on some other projects dealing with for example, moms and like their maternity care experience and often feeling rushed. So I think that's another aspect of it. Like you're finding out that your child is deaf or hard of hearing, and they're like, oh, we got 15 minutes. Listen, I need more than
Yeah.
minutes to process this. I have questions. So it should not be so. We're human beings, okay? Like you tell us some very emotional things and you just need some time. So really
Yeah.
being able to engage with parents in a way that's meaningful and intentional, and they won't have to worry about how am I going to pay for this? I have questions, but I don't know how I'm going to get in contact. I really need a face-to-face appointment with a social worker, but will my insurance cover it? Those should not be concerns among parents trying to get the best care for their children.
It
No,
really shouldn't.
100%. It really shouldn't. Sorry, go ahead.
I was going to say another thing. Thinking about policies and coverage, we definitely need to make sure that um, our our children that are not born here can receive services here. That those services can be extended to them. I know that in this particular day and age, a lot of immigrant families are very scared to access these um, these services. But it is something in which, our social workers, our community health workers,
Yeah.
our people that can bring the services to them through a trusted source so that they can access it will mean all the difference. And I think there will be better engagement and follow up along the entire continuum. Very, very important. Also, we need to do a better job of it's not a policy, but certification. We need a national certification for audiological assistants so that they are trained in a standardized manner. And part of that training is how to be a facilitator in teleaudiology, having the counseling training, how to work with families in a very empathetic and professional manner, and also the recruitment of diverse audiological assistants, both culturally and linguistically. We need our Haitian Creole speaking audiological assistants. We need our Spanish speaking, Chinese, Japanese, Portuguese. We need them in the community to be able to reach our families that are in need.
Perfect. So are there not so tell me more about the assistants. Are there currently not assistants and that's something that needs to be created, or could can I just be like, "Yep, I'm an audiology assistant," and pull up? What does that look like?
So, in the state of Florida, if you have a bachelor's in communication disorders, you can be a speech language therapy assistant, speech language pathology assistant, and you can also be an audiological assistant. So, it just takes having your bachelor's. In certain states, it's different. Maybe it's just a certificate program.
Right.
So, it varies from state to state. There are audiological assistants. Most of the time, right now, they are going to be working as hearing aid specialists, but they are highly, highly, highly underutilized. In fact, in the state of Florida, most people will not go for that extra certification, which it's just a matter of just filling out an application, just because there's not necessarily a job need out there. So they are very, very, very underutilized at this time. The workforce is there and waiting.
Right. So tell me more about what would it look like if we had, or if you had a well-trained audiology assistant. What kind of gaps? How could that benefit these services?
Oh, they could be in the community. They could be actually working in schools or in the community, providing screening for children that have hearing loss. So I myself, I do that every day. I'm a um, Head Start screener. I do speech and language screenings. I've conducted screenings across entire counties where we provide vision, hearing, speech, and language screenings. And you would be surprised, there are children out there that are not hearing. They do have a hearing loss, even at age 3, 4, or 5. Maybe they had it at birth. We don't know. But an audiological assistant can be very, very instrumental in helping to, in real time, in the community, identify those children that are just not hearing, and so that they can get the services that they so desperately need.
Mm-hmm. Dr. Ramsey, did you have something you were going to say?
No.
Okay, perfect. Man, so for those that are listening, those policymakers, those advocates listening, what's the one thing they can do right now to support this expansion in teleaudiology?
Definitely write to your policymakers, Congress, individuals, professionals. If you're a policymaker, be on the lookout for these bills that are coming. There's currently one right now that is talking about the expansion of some of these services via audiological teleaudiology. So these bills are constantly coming out there. Also, be an advocate for the expansion of Medicaid and Medicare services, especially for our elderly and children, special needs, infants. Be on the lookout. These programs and these services are on the chopping block. So
Mm,
you don't have to look too far to do any research. Or it's out there. But educate yourself. Talk to an audiologist. We're available. Please look us up. We're on LinkedIn. You definitely want to reach out if you are looking for someone to advocate with. We are available, and there's plenty of professionals out there that are willing to give of their time to help further sponsor a bill.
perfect. And Dr. Ramsey, I'm curious, is there a way that, outside of healthcare, are community-based organizations or are there other ways organizations can help advance this work?
Yeah, I really think the basic thing to do is to educate people about it, what it is. And I would suggest actually speaking with those with that lived experience to better understand the process, what barriers they're experiencing. Because ultimately this does affect our children, the future. I'm just baffled at all the cuts and things going on for child development. It's just crazy.
Man,
Like, how are we going to mitigate this? Or if you're cutting it, what's the alternative? What is the solution?
Mm.
And it's really going to harm our most vulnerable, which are the babies. I'm just not understanding why you would do that.
yeah, like
Don't get
if
it.
if these kids can't hear, that's the foundation. I feel like you got to be able, if you can't hear, you can't comprehend, you can't understand, you don't know what's going on. And there could be somebody listening and be like, well, why is this such a big deal? Why is this so important? What have you ever tried to, if you were about to drown and someone's trying to give you instructions on how to break free from your locks, you would want to be able to hear. Like, you would be able to hear, how can I unlock myself? I'm about to drown. You know what I mean? Like,
Right.
and it just seems like a no-brainer for me. But, and you brought it up earlier, Pamela, there's a current climate right now that common sense just went out the window.
It is. It's very difficult. So I think that when we're working with various agencies and various individuals that may not think like us, we can just kind of come to a place of grace where we have to explain,
Hey, I don't think
literally
Dr. Ramsey
explain.
agrees with this grace.
Oh, no, I'm in agreement with the grace too.
Yes, it's a lot with the grace, because we have to not talk at 2.0. We have to not even talk at 1.0. We have to bring in like an orientation and just say, hearing is important to all individuals. It is the basis, and it's very helpful for communication. And yes, we have various dialects of American Sign Language and sign language, and that is also very important for our communities. So we're an advocate for that as well. All forms of total communication, we are advocates for that. We also want this piece in place where those that want to identify, so that if they need a hearing aid, if the children need cochlear implants, that they have access to everything they need in order to communicate in the world. That's what we're pushing for, and it's literally no less. At this point, I'm telling you, we are not accepting less. We're not accepting less than that. We believe in and health and coverage and access for everybody. That's not a privilege, it's a right. And in 2025, we're accepting no less. No less.
Love it. I love it. For somebody that's going to be not only listening, but maybe might watch this or see a clip or whatever, and they wanna learn more about teleaudiology and the project and the work that you're doing. Where can they find more about this work that you guys are doing?
Oh, easy. You can just reach out to us on LinkedIn. My name is Pamela Rowe, speech language pathologist. I'm on there. And Dr. Ramsey, what's the best way to reach you?
I would say the same thing. I am on LinkedIn, Lauren Ramsey. I'm my email address. I think that's okay too.
Okay, and I'll make sure I have all that in the description. Whatever you want to have in the description of the episode, I'll make sure I have in there so people can reach out to you. But Dr. Ramsey, Pamela Rowe, thank you guys so much for being on the podcast, talking about this very important work and this very important project, because there are a lot of communities that need it, and we need the right people to hear it. Bars. I wasn't even trying to say that. I wasn't trying to do that. But there are people that need to know what's going on and understand how we can close gaps in care and all aspects of somebody's health and wellness journey. So I really appreciate you guys being here.
Thank you so much.
Yes. Everybody, thank you so much for listening to the Healthy Project podcast. Don't forget to subscribe. Don't forget to review this episode and let me know what you think about teleaudiology. And if you have any follow-up questions for my guest, you can reach out to us at hello@healthyprojectmedia.com. Again, thank you guys so much for being here. Thank you so much for listening. I'll holler at you next time. Hey, thanks for joining us on the Healthy Project podcast. At Healthy Project Media, our mission is to connect with the next generation of health leaders and innovators. If you're interested in advertising with us or exploring collaboration opportunities, please reach out at hello@healthyprojectmedia.com. We look forward to growing this community together. Until next time, keep pushing the boundaries of health.